Mucocele. Coming on to the introduction. The mucoceles are mucus-containing cystic lesions of the salivary gland. The wall of this cavity is formed by compressed bundles of collagen fibrils and it is filled with mucin. And it is a generic term used to refer to lesions that result from trauma or obstruction of minor salivary gland ducts. So the mucocele is a dome-shaped, fluctuant, bluish, non-tender submucosal swelling with a normal overlying mucosa. So in this image, it shows a clinical presentation of the mucocele on the lower right lip. Moving on to the classification, and it is classified into three types. First is extravasation mucocele, and second one is superficial, and third one is retention. So extravasation mucoceles. The most common lesion of the salivary gland due to traumatic origin. The lesion is characterized by pooling of mucus in a cavity within the connective tissue due to rupture of salivary duct or acini. Not a true cyst because it lacks an epithelial lining. Moving on to the etiology and pathogenesis. So it's a traumatic severance of a salivary duct such as that produced by biting the lips or cheeks or pinching the lips by extraction forceps. Clinical features. The extravasation phenomenon involving the accessory salivary gland structures occurs most frequently on the lower lip. Also occur on the palate, cheek, tongue, and the floor of the mouth. So there is no sex predilection. The adolescents and children are commonly affected than adults. Clinically, the lesion may lie fairly deep in the tissue or be exceptionally superficial. In such cases, we call it as a superficial mucoceles. Deep in the lesion, it is manifested as a swelling, but because of the thickness of the overlying tissue, the color, the surface, and all those things appears as those of a normal mucosa. Contents of the cyst is a thick mucinous material. The lesion regress and enlarge periodically and may disappear after traumatic injury, which results in their evacuation. They almost invariably recur. Histological features. The extravasation cyst consists of a circumscribed cavity in the connective tissue and the submucosa, producing an obvious elevation of the mucosa with thinning of the epithelium as it were stretched. Its wall is made up of a lining of compressed fibrous connective tissue and fibroblast. Tissue wall is a granulation tissue that shows infiltration by numerous polymorphonuclear leukocytes, lymphocytes, and plasma cells. The lumen of the cyst is like a cavity which is filled with eosinophilic coagulum containing variable number of cells, chiefly leukocytes and mononuclear phagocytes. The adjacent salivary gland whose duct was transected and undergoes inflammatory change, showing duct dilation, chronic inflammation, axonal degeneration, and interstitial fibrosis. Second type is the superficial mucoceles. So it's a variant of the extravasation type. They are caused by small extravasations intraepithelially or occasionally subepithelially. Arise as a result of increased pressure in the outermost part of the excretory duct. The lesion lies superficially and appears as raised circumscribed vesicle, several millimeter to centimeter or more in diameter with a bluish and translucent cast. These lesions are asymptomatic and numerous, occurring most commonly in the retromolar area, palate, and the posterior buccal mucosa. Typically seen in females of middle or late age, frequent in patients with oral lichen planus, and their clinical appearance suggests as a vesiculobullous lesion, but the lesion persists on for an extended time. Third one is retention mucoceles. The mucous retention cysts are true cysts that having a epithelial lining and are relatively rare. Obstruction or constriction of the salivary gland duct causes retention of the saliva within the duct and ductal dilation without rupture. Etiology and pathogenesis. The mucus retention cyst develops due to obstruction either by salivary calculi or by a mucus plug. Constriction of ductal orifice due to the continuous use of certain mouthwashes also. Clinical feature. This lesion is common in adults and old age. It occurs both in minor and major salivary glands, but the involvement of the major glands is more. Parotid is the most commonly involved major gland, where it presents as a slowly growing fluctuant and painless swelling. Those arising from the minor glands affect the floor of the mouth, buccal mucosa, and the lips. Histopathology. Mucous retention cyst is a true cyst having epithelial lined lumen. The lining epithelium is uniformly thin non-keratinized stratified squamous, cuboidal or columnar epithelium. The lumen of this cyst may contain eosinophilic material positive for mucin. The connective tissue is usually free of inflammatory cells. So, coming on to the differential diagnosis, it can be diagnosed as salivary gland neoplasm, vascular malformation, venous varix, soft tissue neoplasm. But in certain cases, if the mucocele appears in alveolar gingival mucosa, which is rare, and in that cases, we can diagnose it as an eruption cyst or a gingival cyst. Coming on to the treatment. Treatment for mucous extravasation type consists of a surgical excision. Aspiration of the fluid content provides no lasting clinical benefit. Removal of associated minor salivary glands along with the pool mucus is necessary to prevent recurrence. There are various treatment options other than surgical excision. That is, first is cryosurgery. It is well received by patients due to a relative lack of discomfort, the absence of bleeding, and the minimal to no scarring. So it is an effective, simple, predictable, relatively self-limiting, and safe method for almost all types of oral lesions. Second one is intralesional corticosteroid injection. So intralesional dexamethasone can be used as an alternative to surgery in patients who are anxious about surgery procedures and in case of recurrence after surgery. Next is micromarsupialization, and it acts as an effective alternative for the treatment of mucositis, especially in uncooperative, mentally retarded, pediatric age group patients. And all other patients not fit for surgical procedure, it has advantages such as it is simple to perform, less invasive, and is well tolerated by patients, and has no side effects associated with the invasive procedure. Laser treatment is another one. Diode laser is an effective, easy, bloodless, and well accepted procedure to treat mucocele in pediatric patients. No treatment is required for superficial mucoceles because they rupture spontaneously and are short lived. These are the references.